Adult immunization program was started today at Manipal Hospitals here in Whitefield, Bangalore. The event was addressed by expert doctors besides a panel discussion at the venue. There was interaction between the audience and the participants alike here. The discussion concluded that the cost could be higher initially, but it may come down gradually once the elderly gets vaccination drive commences.
In terms of developing new vaccines, how it can positively make a significant impact in our life. I would not extend this session in discussing how we go about it, but we have got a very eminent panels who are going to give you a great context on that. And I think it is going to be seriously impactful in all of your life, because it is, I think, as of now, as a community, is the most neglected subject.
Your childhood, but all these vaccines, kind of vaccination vaccines, what we receive doesn't have effect throughout our life, because anytime you give vaccine, it's a kind of antigen, what we call inject somebody, it induces some antibody response. We produce some protective antibodies, they protect against the disease. So, but they don't stay for long. Maybe some will work for 5 years, some will work for 10 years, some might work for 1 year only. Some of the vaccines are recommended every year, so because the effect lasts for only kind of 1 year or so. So it is important that all adults should get vaccinated for certain diseases. It is recommended as per the guidelines.
One and all, I'm here today because of, I would say, my good friends, the hospital director, and Mr. Arnab, and then Dr. Aditya, who called me a few days ago.
Especially for people who are 65 years plus and people who have comorbidities, especially diabetes, getting what Dr. Ravi Shankar has said, and also those who are immunosuppressant drugs, metabolic disease, rheumatoid arthritis, steroids. All these people need to have immunization. That should be that awareness has to be spread. Universal immunization program for children. So that creates this impression that vaccination is only for children, not for adults. So that's exactly why this whole initiative is started, so that people know that adults can get vaccinated. A lot of diseases we always spoken, especially pneumococcal and herpes zoster in elderly, can be really painful because we have seen patients having post-herpetic neuralgia. It's very difficult to treat with multiple drugs, going on for even a year or more than a year. So it's
they land up in the septic shock. It's very difficult for us to bring them back to the normal. That's the reason. See, always like just medicine is not a magic. Our immunity model always works. Many times there are a lot of questions we get from the patients, especially the people who are in the ICU. Sir, you are giving very high dose of antibiotic. Why is pneumonia not improving? That's a good question. See, even China-Lika and all those things, a lot of people we could not able to save. See, medicines may work for 50%. If our immunity power is not really good, we cannot able to save any persons, whoever we make the things. That's what we have to build up our immunity. In that, the vaccination is the right time, so we have to take in the right this one, so that can definitely help you. Let me ask you, what are the commonest vaccinations?
Vaccine recommendations are same, and there's no evidence of any adverse effect due to the changing hormone levels in the female body.
Thank you, Doctor. Before we move, I think Dr. Virendra, I just have one question. So, Doctor, just help us understand. I think that would be most of the audience question too. Why is that for adult we don't have any kind of calendar, or as we have for kids? Why is that it has not been maintained so far?
That's a very important question, because I think from
and the notion that people have died due to COVID vaccination, it has not yet been proven in the studies. Having said that, most of the side effects what you experience after vaccines are very mild, like maybe a sore throat or a mild fever, not going beyond 24 to 48 hours.
So, what is the level of awareness in Indian context and with regard to adult vaccination?
The level of awareness is not kind of 100%, I would say. I would say somewhere around 40 to 50%, but there's still a lot of people are not aware of taking vaccines in their adult age group. So there is a lot more to be done through the publicity, either through the media or the newspapers or the TV or the hospital programs or the websites, or creating some YouTube links to put it in the healthcare channels, so that it will be useful to the people to read about it and then listen about it, and then probably they come to the hospital to take the vaccine at the right time.
So, do you feel that Manipal Hospitals is taking a lead in this connection?
Yes, certainly the Manipal Hospital Whitefield is taking a lead to create a kind of awareness, as well as set up a vaccination center, adult vaccination center in the health checkup unit, and then permanently there will be someone will be guiding them and then facilitate the vaccination, who come forward to the hospital to take the vaccine, give full information about what all vaccines to be taken, and then so it can be easily facilitated, and then they can avail the benefit from the hospital. It's a good initiative by the Pfizer as well as the Manipal Hospital Whitefield. For that matter, it should be set in every hospital. It should be easily available to take the adult vaccines.